Welcome. Thank you for joining us for this special session of our cross-industry update right here in Boulder County, teaching you a little bit more about the new orders that are taking effect tomorrow, right, for Boulder County that will affect your businesses. If you have any questions, please put them in the Q&A or chat, and we'll get them answered. I'll ask them on your behalf. For anybody that doesn't know, my name is Corinne Waldow. I'm the Senior Director for Economic Vitality at the Boulder Chamber. I'm going to serve as your bridge today, as some of you call it, that bridge between the business and public health. Ask your questions, try to clarify some of that information. But to give you that information, I'm going to hand it over to Jesse Rounds with Boulder County.
Thanks, Corinne. Good afternoon, everyone, and thanks for joining us. I'm going to jump ahead here in the interest of saving time here. I'm going to jump past most of this agenda and try and get to our current, I'll go over the high risk guidance, where we are right now. Then I'll talk about the new order from Boulder County. And then we can spend some time in the possible, what it would look like if we went to stay at home, if that is where we want to go. If there are enough questions about the current order, we can stay here. So just quickly, where we are right now, orange or high risk, used to be level 3 of safer at home. The schools are sort of their own entity, but they are recommended to be remote or hybrid. Higher education is the same. Places of worship are 25% of capacity or 50 people, whichever is fewer. Restaurants are 25% or 50 people indoors, and outdoors 6 feet between patrons. And I'll just note here that restaurants do play a part in the additional guidance from Boulder County that I'll get into in a moment. Offices are 25% of capacity, and that's not 25% of your fire code capacity. That's 25% of the number of people who used to work in your office pre-COVID. I think that's a change that happened over time in recognition of the fact that not a lot of people know their fire code capacity. Gyms and recreation centers under orange, where we are now, are at 25% capacity or 25 people indoors. And actually, I want to correct this next part. Outdoors, you're allowed to be in groups of up to 25. So that is a change that was made recently to the orders to clarify that. They feel like they were a little unclear on that. So again, don't pay attention to what this slide says here. 25% of capacity, 25 people indoors, and 25 people outdoors. All socially distanced, all wearing masks. For group sports, outdoor groups in less than 10, and again, socially distanced, wearing masks. And I should mention that sports within gyms are not allowed, neither are practices. So no practicing if you're an organized sport, and certainly no games if you're an organized sport indoors. Retail is at 25% capacity. Personal services are at 25% of capacity or 25 people. And events are similarly 25% of capacity or 50 people with calculator indoors. And so that again is use your calculator to figure out what your capacity is. Use the social distancing calculator, which is available on the COVID-19.colorado website to get that figure. Outdoors, 25% or 50 people with 6-foot social distancing. So that's it. We can go over those again in detail, and I've got some additional information about some of that I do want to dig into in a little bit, but you'll see that in future slides. So in terms of what can be done, again, require masks, follow state guidance, and wear masks, socially distance, all of those things that we normally go over. I'm going to skip through these next couple slides. Okay, so now this is our new Boulder County Public Health Order that is going to go into effect tomorrow morning at midnight or tonight at midnight, depending on how you look at that. In restaurants, well, okay, let's start with the household mixing limited. So personal gatherings are limited to 2 households with no more than 10 people. That was a state order that we're extending here. Indoor event size. So indoor events are now limited to 25 people as of tomorrow morning. And in the past, that was per room in an event center or venue. Now that is the total venue, 25 people or 25% of capacity. That's not by room, that's now total. And then requirements for outdoor events and sponsored gatherings remain the same as under orange. For adult, high school level, and professional sporting events includes college events, no spectators are allowed at any of those events. Youth events, outdoor, again, following the orange level guidance, parents are still allowed to attend and follow the guidance in terms of number of people and distance, masking, social distancing. The same rules apply. For restaurants, and I mentioned before, restaurants entered into this, indoor dining, each table is limited to 1 household. So regardless of the number of people, it has to be fewer than 10, but it's 1 household. And then outdoor dining is limited to 10 people per table, and it is you can have 2 households. Again, that follows that household mixing that I mentioned at the top of the slide here. And then finally, this is not an order, this is strongly recommended. All businesses, including critical businesses, should, if you have the ability to have employees work from home, you should have employees work from home. Now, I mentioned that there was another part of the order, the existing orange order, that I wanted to highlight. And this is, I think, very important. It's a change in interpretation. So critical businesses, those that are under Appendix A in the order, in the state order, you must follow sector guidance. Capacities, cleaning, temperature checks, all of that, unless it is impossible to carry out, unless it would make it impossible to carry out critical functions. And you know, from public health's perspective, impossible is very important there. We're going to be looking at businesses. If we get complaints about businesses not requiring masks, not doing capacity checks, the question is, would it be impossible to do those things and still function? So for critical businesses, that's a big change. And so that's everything for orange and the new order. I do want to remind you, the slides I skipped over, really, again, just the sort of practices that we all need to maintain. And then in addition, the exposure notification tool that the state has made available on your phones, that you can download on your phones. Just want to remind you to do that. I am now going to move forward to what would happen if we move to stay at home. And this came up on Wednesday a lot, and I'm sure people are going to jump on this late and be scared, and so I'll try and remind people over and over again, this is a what if situation. I'm going to go over the stay at home orders without, there is no evidence that we're moving to stay at home anytime soon. Though our numbers are heading that way, that's why we want to talk about this, so that you can plan ahead and be prepared for if and when that happens. So under stay at home, and this is actually great because it'll compare the two. For restaurants, there is no indoor dining under stay at home level red. Now you get 1 household per table indoors, and you get up to 50 people indoors. Under stay at home level red, outdoor dining is permitted as long as you've gotten approval from your local municipality, and 2 households per table up to 10 as long as you're spaced 6 feet apart. So that's the same as under level red. They are the same right now. Office-based businesses must be closed for in-person work under red. Obviously, that's 25% now. That would go to no being closed under stay at home. For retail, It would be closed for in-person work. Curbside pickup or delivery is allowed, and that's a big change from the previous stay-at-home order. We really encourage businesses who are able to stand up a curbside pickup or delivery service to look into that possibility. We want people to take advantage of that if it's possible. Manufacturing under so this is non-critical manufacturing. Again, right now, 25% posted occupancy, not to exceed 50 people per room. That also holds true for critical manufacturing, unless it's impossible to meet that goal. Under stay-at-home, they're closed for in-person work, but may remain open for minimum basic operations. That's where there's a little bit of a difference. We want you to reduce your, for critical manufacturing, you need to reduce occupancy as much as possible, again, trying to meet that 25%. But obviously under critical, you would be allowed to stay open and operate at a minimum level during stay at home. For field services may continue to operate, and real estate can have open houses as long as they meet all of the indoor events requirements. Under stay at home, they would be closed, no open houses. For personal services, 25% of posted occupancy, not to exceed 25 people per room. Under stay at home, they would be closed except for minimum basic operations. For limited healthcare settings, right now they follow the personal services guidance in terms of occupancy levels. Under stay at home, they would also need to be closed unless services they were providing were approved by a licensed medical, dental, or veterinary practitioner in accordance with Order 2029. And if you have questions about that and who has the ability to approve services, I would check the Department of Regulatory Agencies, the DORA website, as well as CDPHE's covid19.colorado.gov website. They'll have all the information about how that would operate. And again, all critical businesses must follow the guidance unless it's impossible to carry out critical functions at that lower guidance. So moving on to gyms, they would be closed for indoors under red. Again, right now they're at 25 people indoors. For outdoors, including pools, you are allowed to stay open at 10 people per class in the outdoor areas. And then again, also obviously virtual classes are permitted. For our ski resort, obviously they're allowed to operate right now once they're approved. And then under red, they would be allowed to continue to operate as long as indoor areas are closed, and the food service would have to be sort of takeout, curbside delivery. For outdoor recreation businesses, 25% capacity, not to exceed 10 people now. That would be 10 people with social distancing under stay-at-home level red. So that's allowed to continue. Events, under both, for both indoor and outdoor events would be closed. Schools would be allowed to operate under BCPH approval. So that's because they operate under a different set of rules. That's a negotiation between the school districts, the state, and the county. Houses of worship, for indoor services, 10 people or fewer with social distancing between non-households. And then outdoor, they would be permitted with social distancing. And then gatherings generally, that's the big hit. This goes back to where we were before. You need to go back to being just your household by yourself. And that's the danger of moving to that level red or stay at home. But I want to remind everyone now that we've gotten all the way through that. We are at level orange with the additional strictures of the county local order. So Minimum basic operations, this is a long definition. I'm not going to read it, but you can look into that. There are many sectors that have that minimum basic operations option for continuing to operate. Look into that. If you can do that, that's a great way to keep some activity occurring in your business if we move to stay at home. Switching gears completely, and I will try again get through these pretty quickly. I know we're already at 15 minutes here. So sick employees versus outbreaks. A single employee does not make an outbreak. An outbreak is 2 employees over a 2-week period. A positive employee, and now I want to do some more definitions. A positive employee has tested positive for COVID-19. A close contact is someone who has been around a person who has tested positive for more than 15 minutes in a work shift or 24 hours. So those are just some basic definitions that I want to put out there. In terms of quarantine, so quarantine is what happens when you have been a close contact of someone who has tested positive. You need to quarantine for 14 days, and there's no getting out of that 14 days, whether you have symptoms or not. If you feel like you want to get tested and you don't have symptoms, then you should wait at least 7 days from the beginning of quarantine to get tested. Isolation is what happens when you've tested positive for COVID-19. You must isolate for at least 14 days, and then it really has to do with how your symptoms decline after that 14-day period. But isolation is only for people who have tested positive. Another slide from last week, and I just, testing is a good tool for all of us, along with tracking and tracing, but it does not absolve you of quarantine if you have to go to quarantine. It tells you if you are sick or if you have the virus at a particular point in time. You could get enough viral load or get sick the next day. And so a test yesterday doesn't tell you anything about what's happening today. And so that's really important to be aware of, unless you get a positive test, in which case it does tell you that you're still positive. And finally, it cannot be used to shorten or avoid quarantine or isolation. You need to stick with those. And with that, again, I forgot to update the slide, but Wednesday at 3 p.m., we do our general updates and guidance webinar. Please continue to come to that. We can go into more detail in those, but our Wednesday 4 p.m. is set aside for special subjects. This week, we sort of bled into the 4 p.m. call so that we could really get into some details and some questions. And then our Spanish language session is recorded in advance and then released on Thursdays in collaboration with the Latino Chamber. And finally, if you want to contact us, please do at covidbiz@bouldercounty.org. And that's it. Happy to answer any questions.
Well, believe me, Jesse, we have lots of questions.
I figured.
I've gotten texts, emails, chats, and Q&A. I am asking people to please put them in the Q&A. I will get the ones that are in the chat right now if possible, but it's a lot easier to manage this number of questions and this number of people in the Q&A because we can move them out in a Q&A feature. Those of you on this side of the webinar. So let's talk a little bit about the Boulder County public health orders that came in place this week, or that start tomorrow, that were enacted yesterday.
Yeah.
A lot of questions came in. These are on top of the level orange. So if you are not mentioned in these orders, retail, personal services, houses of worship, you are operating under orange. So your capacity levels are what they are at orange unless it's otherwise designated in here. Yes. So even restaurants. So restaurants can operate at the 25% or 50 people per room, whichever's lower numbers, that capacity number. The only difference here is that now the tables indoor are limited to 1 household, and outdoors it's limited to 2 households and 10 people,
Yes,
correct?
yes, exactly so.
Now, the time that might change is if a restaurant has an event, correct?
Yes. So if you go to an event, then you actually get a reduction in the number of people available or
So,
people who can attend.
so that is where I think there was a lot of confusion because they saw the capacity limits for the events, and then they saw these limits on restaurants, and there was this confusion. Well, now am I going to capacity limits of 25? Restaurants can still operate under the 25% or 50 people, whichever's lower per room, and a room is four walls and a door. But now the limits are on the households. Let's go to what level of responsibility does a restaurant have in enforcing the 1 household per table rule? How do they verify that it's people under the same household? And Lane, I just saw you unmute. If you wanted to answer that as well.
I'm ready, but
Okay.
no, I was just gonna say that I mean, how would you find out? Ask the question. Are you all in the same household? So your responsibility is really just that of trying to keep yourselves open. We are not going to do enforcement on restaurants based on complaints of, allowing larger groups and things like that, beyond the capacity of if you're over 10 people. But this is your livelihood. So you can take this, as much as you want to put effort into it, it's up to you to help this be successful. So we aren't there to be able to police every group that comes in. But this is a risk. We know that restaurants, people are going to be unmasked. They're indoors. Those are 2 huge risk factors. So this is the way to stay open, and skirting this is going to really move us more quickly to stay at home. So we really just need people to help with this, but you are not being tasked. This is not your assignment to police this. You're not there to, call the police every time you find a group that's not doing it, but it does relate to your livelihood and your ability to stay open.
And this particular part of the order, instead of saying blanket, you're now down to 25, it goes to the heart of where the spread is happening in large parts of our community, which is those social interactions. Those families getting together and unmasked and having those social interactions. So that's kind of where this part of the order is trying to get to the heart of, or those after work beers with larger groups of individuals getting together, unmasking, letting their guard down and potentially spreading the virus, correct?
Mm-hmm.
Yeah, I mean, the threat of us going to stay at home has been looming over our heads. We've been in the red for case counts for quite a while, and they're not going down. They're continuing to go up. We skipped over that because we talked about it Wednesday, but so the threat is very real. If we don't see things turn around, the businesses will bear a huge part of us staying at home. But we don't want that to be the case. So we really need people to get this and care about the businesses and follow through on what the requirements, are set at.
Okay, so we're gonna do some more clarifications on. I'm gonna stick to this for a little bit. We're gonna do some more clarifications on this. Are classes considered events? For example, gym classes, or
a gym class is no. It's considered a gym class. So that would be at whatever the gym class, which is 25 people per room, or 25%, whichever's smaller.
so you need to stay following your gym orders, making sure people are masked, they're socially distanced, all those pieces that fall under gym orders. The pieces that fall under this event, I think it's like Appendix I or something under the order. The things that are covered under this event are those things that are covered under Appendix I of the event of the order.
Yep.
Okay. We're going to keep going. Under level orange, does the 10 people, 2 households max for personal gathering, which is also in this order, only apply to indoor or also outdoors?
Sorry, the 20, the
10
The two
people,
households?
personal household mixing limits.
all the time, everywhere, indoor, outdoor, all the time.
And
So
that's
if I run with a group of 6 other guys or women, and that's really not really within the limits of the order.
Yep.
I go and have a pickup tennis game with 3 other ladies. That's not within the limits of the order.
Yep. Yeah.
and that's a state order, just to be clear,
Right.
that's already been in place and that's still in place.
Yeah.
When you're talking 25% of the number of people included in a space, does it include employees? And I think we need to clarify when and when it does not include employees.
Okay. I'm not sure if I can go sector by sector off the top of my head, but so for gyms, for example, it does not include employees. For restaurants, it does not include employees. Let's see, maybe if I can go back through the
Retail, it
sectors.
does.
Retail, it does.
Office, it is.
Office, it does.
Employees.
Personal services and limited healthcare, it does. And events, it does not.
Okay, so for gyms and recreation, 25% or 25 people indoors. It says 25 people per room. If a gym has more than one room, what does that mean for that gym? And how does that room really need to be set up in order to qualify to have more than just
Okay.
25 people?
So a room is 4 walls and a door that is closed. And that
Is it mesh?
No, it is a solid construction wall. The one caveat to that, I guess, would be sometimes in gyms, the divider is not a solid divider. It's one of those accordion dividers, but those are floor to ceiling, hard, non-permeable, wall to wall, floor to ceiling, non-permeable closures could make a large room into 2 smaller rooms. But in most cases, these gyms have, the curtains that drop down. Those do not separate rooms.
But if you are a facility that has more than one classroom, you can have, if it's big enough and your space allows 25 people, you can have multiple rooms with that.
Right. Remember that the capacity, and thank you, Corinne, that's really important. The capacity is 25% or 25 people, whichever is fewer. So you really look at your room size. If you're concerned about, I don't know the fire code, look at the social distancing calculator. That'll help you figure out what your capacity is for that space.
And then there's other things to think about as well, like when you're walking into a facility, making sure not all 50, again, you have to have a really large facility in order to have the 50 people, 25 in each of those rooms. But making sure all those people are not convening in a singular location at the same time if you have 2 classes starting at the same time and so forth. How many outdoor tables are allowed of 10 people?
It's whatever your space is. There's no limitation as long as you can maintain 6 feet and the space is properly permitted with your municipality or with Boulder County, depending on where you are. But it depends on the space you have available and the ability to maintain 6 feet. And it's not just 6 feet between tables, it's 6 feet between when my neighbor and I pull our seats back, are we still 6 feet apart? Getting up to leave or to go to the bathroom, whatever it is, you have to maintain, there has to be a lot of space between those tables.
We've been doing these too long together. You knew what my next question was going to be with this to define 6 feet there. All right. Are indoor pools included in the gym classification? Indoor hotel pools included under the gym classification?
Indoor pools are
indoor hotel pools.
Yeah, indoor hotel pools. Thank you. So they fall into an interesting category. So they would still need to be at the 25 people or 25% of capacity under yellow, they need to be at that level regardless. The difference is that those pools where you're limiting access and it's only certain folks, I believe, and I will check this for hotels because for a condominium, for example, if it had an indoor pool, that could continue to operate under stay at home, I believe. Gyms can under stay at home, but I don't know about hotels. Let me check.
Okay, so is an optical center retail or medical?
It is almost we talked about this morning in another call. An optical center is limited healthcare.
So it falls under the limited healthcare part. If they have an office area, do they need to operate the office part under the office guidance?
Yes. And so go ahead.
They may have a retail as well if they have a shop and a store where they have, people can just go in and shop. So they could be under multiple categories depending on how they're set up.
And we actually have quite a few people that are new on these calls. So this might be a good reminder that you might fall under several different categories. You might be personal services that has a retail. You might have office that has retail. It gives, again, that reminder that you might fall under several different categories, which brings me to another question. We have a local company on here that has office and warehouse space and wants to know how to figure out the capacity of how many employees can come in. They have office space and warehouse space. And so how do they calculate their 25% office and how do they take into account their warehouse area?
So there's two separate spaces. Their offices is, like you said, at 25% capacity, and their warehouse is probably considered manufacturing. So but that's also at 25 people or 25%, I believe.
And under the office space, it doesn't matter if each person has an individual office. It's 25% of the number of desk spaces or office spaces that you have that is allowed to continue, correct?
Mm-hmm. Yes.
Okay. Doesn't matter on square footage?
It does not.
Okay.
Okay. Wow. Thank you. One caveat to that is your desks. So if you go down to 25% capacity, but put all of the people who are working there's desks right next to each other, you're violating the order. They need to maintain 6 feet of distancing. Everybody needs to be wearing masks. So you need to use the desk space you have to spread people out as much as possible.
Okay. So I think this person has really large space. So they were, in that case, but that's a good reminder that if you had, if beforehand you had people sharing desks and they're really close and you go down to 25% and you still have very close quarters, that's still not maintaining that social distancing. So you need to make sure you're extra conservative in that case. We asked this question the other day and I'm going to say it again. So in that case, I have 19 spaces, 25% is 4.25. Should I round up or down?
Round down. It's just safer.
Because in here you have a strong recommendation to work from home. Now that's not a requirement, right? But what is it saying to our community?
I mean, I think it's saying that these interactions between households are the dangerous thing that we do every day, and so limiting those is the way to limit the spread. And just to jump back to answer the question, under level red, stay at home, hotel pools can continue to operate. Hotel gyms can continue to operate as long as everyone maintains 6 feet, masking, all that sort of stuff.
So they're similar to the apartment complex,
right? Yeah,
which is very similar to what happened in the stay at home before. Okay, so we're gonna keep going through this. I I often say, we have a lot of questions that come in. Do the number of cases, we have a drastic increase in the number of cases. Is that just because we're testing more?
No.
And how do we know that?
Because our positivity rate is a good way to separate out the number of cases we're getting from the amount of testing. And our testing, and Lane, I'm sure you know this better than I do, but so from sitting in on conversations and listening, our testing levels have been about the same since September, since the CU outbreak. We really ramped up our testing, and those numbers have been really good, and we want to continue to encourage people to test. But our positivity remained pretty steady through the CU outbreak and then for weeks afterwards, and it's only now that we're seeing a slight uptick in positivity.
Yep, that's 100% accurate. That we've been seeing that positivity rate. So that's the amount of people tested, how many people test positive out of the bulk of people you're testing. So we saw that number staying well below 5% for quite a long time. And that has continued to climb each week, each day. And now I think we're over 7% positivity rate. So that has been concerning. So it is not just that we doubled or tripled our testing. In fact, we've been pretty stable on testing. Some testing sites have even closed down. We've opened up others. So trying to move around access within the county, but overall testing is not continuing to go up and up. It's more stable. If anything, it's maybe declined a little bit from its peak during the CU surge.
So the percent positivity rate is that constant indicator that we've had since March that kind of says this is that, even with tests going up, what percentage of those people that are getting tested are positive. And then you're also looking at the number of tests, things like that. Okay, we're gonna stay on this slide real quick. A museum, they be switching to 25 people total instead of per room if the space allows? Again, the lines between retail space and venue are confusing. And so they're just kind of curious as to, they want to do the right thing.
So I would say that a museum, except for your gift shop, is not a retail space. I think it's possibly education, but I think events and is probably your best guide there. That would be my recommendation. I don't know, Lane, if you have a different feeling there.
No, I agree. I think we're really looking at how the space is used more so. I mean, it's difficult with, the state putting these sort of definitive categories when not everybody fits easily into a category. So you're really looking at how is the space used. And since a museum allows people to pretty much go wherever they want, unless you've now structured it to be only, led, by a person, then it could be considered maybe a class if you're structuring how people move through the space so that they must follow a certain parameters. So if you have other questions, you can reach out to our team. But again, if it's just people can pay and wander around the museum at their leisure, then that's more of an event space.
All right. So again, we have some new people. Can you define critical businesses? And I put the link to the actual state order into the chat. And in Appendix A, which starts on page 33, is the defined categories of critical businesses that really come out in the order. But could you define critical businesses a little better and kind of give people a sense of what that really means?
I'm not sure I can define critical business better than the order does. I'm scrolling down to Appendix A so I can see if I can give you all the exact definition as it's written. So a critical business is any business, including any for-profit or non-profit, regardless of its corporate structure, engaged primarily in any of the commercial, manufacturing, or service activities listed below. That doesn't help you. So basically, healthcare operations, critical infrastructure, critical manufacturing. So that's manufacturing that's telecommunications or manufacturing things that are specifically targeted towards addressing COVID-19 and the pandemic. Sanitary products, agriculture is a critical manufacturing field. Critical retail or grocery stores, farm and produce stands, gas stations, marijuana dispensaries, liquor stores, hardware stores, and firearm sales. And then critical services are things like trash removal, houses of worship, funeral homes, warehouses, building cleaning and maintenance, moving services, animal shelters, and then news media is a critical business. Financial and professional institutions, so banks and credit unions can remain open. And
then transactional type things. So like they kept some things that, if people had a real estate transaction in the process, they still allow certain parts of that because, not allowing people to not be able to get their money or certain things that would allow us to continue in department, manufacturing. There's also categories that have to do with like defense and, food manufacturing and things like that. So I think it goes into a lot of detail in there. And I think there's a lot of questions is, do I fit in here? Do I not? We went through this in March. If you have questions about whether or not you're a critical business, in some cases that may be a legal question. In some cases, it may be something that you can reach out and can be to check to whether or not you fit into one of those categories. So Appendix A in the order defines critical businesses, critical within those categories. So, all right. We're gonna keep going through. Let's talk a little bit about quarantining and sick. And I think there's questions about, I think we have some nervous people on the call because we talk a lot about sick employees, but sick customers and specifically customers in the personal services. So let's start with quarantining and sick. We put links in, but again, quarantining is 14 days, whether or not you got a positive test, correct?
absolutely correct, yes.
In fact, there's really no value in you doing testing. So you're just expending resources that won't really help you one way or another. The caveat being, if you become ill while you're quarantining, then you can get tested to see if that illness is COVID versus some other illness. But you do not get to remove yourself from quarantine because you get a negative test, because you still could become positive all the way up until the very end of the 14th day. So that's why it's a 14-day quarantine period. And none of the diagnostic tests are predictive to know that you could become ill within X many days. So getting testing is not going to help you. In fact, it's just going to strain the testing resources.
So, and the person can't go back to work even if they have no symptoms. So, I mean, I got the dreaded call this morning at 7 a.m. that said my son was exposed at school and now must quarantine for 14 days. And so, cute kid, 13 years old, in his room with a mask, walking around with hand sanitizer and wipes every time he goes to the bathroom. I love my child, but he's taking it very seriously. But for the next 14 days, he knows he's quarantined, and I've been on enough of these calls. I'm not going to get him tested and know that that's going to be he's out of quarantine. So,
and I think there is one caveat. We may not have ever highlighted this because I don't know how many folks are in that sector, but the critical sort of infrastructure sector, thinking of our police, fire, medical services, there are some exemptions if they were in a sort of a high risk exposure, which they are, in the medical field on a daily basis because they're treating COVID patients. So they do not necessarily have to follow, those 14-day quarantines. There are some exemptions for some of those people because they're already typically wearing higher level protective equipment and things like that. So just in case you have some of those folks that are joining this call, that there are some critical infrastructure exemptions to that quarantine.
So then the question comes up about, pay during quarantine times. And this is, especially since, there's the FFCRA and a lot of questions around that. And so one thing that we know these questions keep coming up. One thing that Downtown Boulder Partnership and the Boulder Chamber has done is we're going to be announcing it and sending out the information. It just got finalized yesterday as we're putting together a webinar with Employers Council next week on the 19th at 1 o'clock to kind of ask some of the questions about, testing, paying employees during testings, quarantining, those types of things. And I'm going to put a link in the chat to Downtown Boulder Partnership's registration page. Thank you, Terry and PPP, for having that ready for today's call. But that's on the 19th at 1 o'clock, because we know there's a lot of questions, especially since FFCRA is dependent on seeking medical care and getting tested and some of those things. So we're going to have 2 people on the call trying to answer as many questions about some of these pieces. Do you have to pay for when you send somebody to get tested? Do you have to pay during, depending on your industry? So please know that we've heard those questions. We're trying to get some resources and answers. Not sure Lane and Jesse can answer some of those questions today. So trying to provide the resources there.
And Corinne, I was going to just share, I think this has come up. I posted it in the chat. So again, I know Corinne said it multiple times. Please don't put your questions in the chat, because we're trying to use that as a resource as well, not only to manage the questions, but for isolation, which is again, when people are sick, businesses should not require their employees to go get tests to prove that they're no longer ill in order to come back. They should follow the isolation requirements, which basically says you can stop your isolation once it's been at least 10 days from when your symptoms began, and you've had at least 24 hours with no fever, and that's without using any medicines to knock your fever down. So that's kind of the requirements to be removed from isolation.
And we had a question on Wednesday's webinar, which was a good question, and it actually says it on there. What if you never had symptoms? And it says you must isolate for 10 days after the positive test, even if you didn't have symptoms.
Correct. And so that the reason again there is people can still shed virus. We have that as a significant part of, I think, why the disease is moving around, is some people are sick and never develop symptoms. So they're just basically sort of super spreaders, if you will, because they don't realize they're sick and they're out there and they can still shed the virus.
And there's misunderstandings about the quarantine. I hear people all the time, oh, I was told I was exposed, got a negative test, and then, so I'm fine.
Yeah, again, that's why we don't encourage people, because you were an exposure, to get tested. You can easily have a test that passes and then you can become sick the next day, or then the day after that, all the way up until the 14th day. So that again is not a valid use of the testing. Again, the exception is during quarantine, you become ill and you go get tested and then find out now you're positive. Now you're going to move from quarantine to isolation, and now begin that isolation until you resolve symptoms.
Okay, so I'm going to ask Stephanie's question again. She asked it last, but then wasn't on the webinar and then emailed it. But when you look at that close contact at work after an employee becomes ill, do you look at things like masks, 6 feet apart, those other considerations when evaluating who should go home after who's been exposed in a positive case? Things like masks, 6 feet apart. Go ahead.
Yeah, the 6 feet apart is definitely, if you were more than 6 feet apart, if people were on opposite sides of the building, or even if they were in the same office, but it's a large space, that's definitely something we look at and something we talk about. Masks, there's been discussion about that. The CDC actually says that masks should not be used as, as a way to ignore, like to stop a close contact, or to assume a non-close contact, because, and I'll speak for myself here, most of us have no idea how to properly wear a mask. So masks are great, but unless you're wearing them exactly right, they're not 100% effective. An N95 is not 100% effective, for example, unless it's worn correctly. So the CDC does not consider mask wearing as a replacement for being more than 6 feet or more apart.
But you need, so making sure your office, you're not allowing convening in the lunch areas, and you're continuing to operate within 6 feet. taking into account all of that, that is taken into account when you assess close contact of a sick employee.
Absolutely.
But you're saying masks is, if it's just masks, that's not one of those considerations.
Right.
We have a question that says, let's say we have a really large room and we have 6 feet apart. Do people still have to wear masks?
Yes.
Okay. So,
Yeah, I guess just to come back to that is what you have to do and what you should do. It is kind of where it's really challenging. You know, we're really working so hard to prevent disease and also to support businesses not going to a closure. So, you know, just to let people know, going above and beyond is an important thing to think about doing, not just the bare minimum of what you do or don't have to do, but indoors, the risks are 19 times higher than outdoors. So wearing masks is so essential indoors. That's why, even though people don't like it for working out, you need to be in a mask. Indoors is a great risk. So again, that's why restaurants, we want to support restaurants being open, but people are not going to be masked and they're indoors and they're, you know, only maybe 6 feet away. So there's lots of risk factors there to allow spread. And we are seeing outbreaks across many different business sectors. So it isn't only personal gatherings. That being said, that's probably one of our biggest concerns because it's largely unregulated. What you do in your own home has never been something that government or law enforcement largely regulates until you start to become a nuisance property and disturb your neighbors and do things like that. So,
yeah. So let's talk about space. If you have an upstairs, downstairs, it's just the stairway. You have an upstairs, downstairs. Is that considered 2 separate rooms for calculation purposes?
The stairway is not considered a room. So
if there's a door for the stairway, then
yeah,
it would be 2
if there's a door separating, but let's say it's open space, and you can see the upstairs and downstairs and it shares.
Nope, that's one room.
If there's a door that separates, though, the upstairs and the downstairs, so that door is the key. Okay. So there's a question about, okay, I got that one. On large tennis courts, do they have to wear masks while playing tennis?
It doesn't.
You do, and outdoors, if you can't maintain 6 feet of social distancing, you do.
So indoors, yes. Outdoors, if you're not maintaining. So definitely making sure.
Just this came up actually not in a public discussion, but the bubbles that they're putting over tennis courts and pools, that makes it an indoor space. So just that's indoors.
Okay. All right. So let's talk a little bit about, I think this comes up in personal services a lot, massage, hair salon, so that you're coming, you know, it's a little different than some of the other industries. So you're coming close contact with individuals. So we've talked about employee exposure. So, you know, your employee says, I'm sick. What do you do? Let's say you have a massage client who calls you and says, I came in yesterday and I've tested positive. What do you do?
So we will reach out to you as soon as we can. And what you're looking for is who was in close contact with that customer. And anyone who was in close contact with that customer, and I am assuming with a massage or a hair salon appointment, you're going to be in close contact for more than 15 minutes. So those people who were within 6 feet of that person do need to quarantine if it was more than 15 minutes.
14 days?
Yep.
Okay. So that's why making sure within your operations, the minimum number of people, you know, coming in contact with each person is probably to your benefit. I was talking to someone earlier that says, you know, not having a lot of points of contact along the way is probably to your benefit. So if that client does come in, they've seen one person, and then they leave seeing one person, and that you're making sure you're doing all your sanitizing, that you're wearing masks, you're doing the distancing, so that exposure is limited within your organization.
And personal services can certainly do customer screening before they want to do that. So massage, running through the symptom screening Certainly you could even do forehead temperature checks. There's nothing precluding you from doing all that stuff to be extra diligent to protect yourselves, so that your business doesn't get impacted.
So we're talking a little bit about, so we have someone on that offers shared workspaces, offices, and meeting rooms. How do you do the capacity? What's something to think about? First off, shared spaces, but then also how do you figure out that capacity calculation?
So your capacity calculation is just the space that's there and the number of, so if you have an open plan office, take your number of desks, divide it by 4, and that's your number of, that's the number of permissible desks. Did I do that math right? I think so. And then if you have closed off office spaces, you again, those rooms with a door, that's totally allowed to have a person in there by themselves. They can even take a mask off, although if you're going to do that, be sure that you're cleaning a lot between uses of those individual spaces. And meeting rooms are no-no. Just hard to maintain 6 feet of distance, hard to maintain people not wearing or wearing masks, hard to stop people from taking masks off. And I don't know, did I miss anything else, Lane?
No, we've talked about this in the past, and I think it's good to remember again the single entryways and exitways of those spaces, remembering your bathrooms and your shared spaces, especially if you're not doing the strong recommendation to work from home, that you think about all those spaces. So you mentioned a comment earlier about the bubble on the tennis and pools. Does that also mean that those tents for dining make them indoor spaces as well? Can you define how many walls make it indoor and how many make it outdoor?
Should have looked this up beforehand, huh? There is a definition. Lane, I don't know if you have it off the top of your head.
Yeah, it's based on how many walls. So if you have 3 or 4 walls, it's automatically indoor. If you have 2 walls, if they are 2 adjacent walls, then it's still considered indoor space. If they're opposite walls, so that the air can move freely through the whole space, then it's considered an outdoor space. That is from the state. So if you don't like how that's defined, that is unfortunately what we got. The other consideration is how you're ventilating. So once it is sort of an enclosed space, a tent, is now that's the concern, is that you have confined airspace. How are you heating that? And it can often be worse than your indoor space that does have a ventilation system that's bringing in fresh air and moving air around, whereas a tent, unless you have some kind of system that's added to it, now you've just enclosed all the air and it's all staying in the same space, not being turned over.
Okay. Gonna move back to the clients who test positive or have to quarantine. So if you have, I don't know, a dance patron or a yoga page, they're asked to quarantine. They shouldn't be coming in and doing into your business.
No.
What about their siblings? Let's use my son as an example. I'm going to use myself as an example. My son has been asked to quarantine. We're quarantining him. He's not exposed to, we're keeping him in a separate room. What about his brother?
Contacts of a contact don't have to do anything. So your son was in a case where he was around somebody with COVID, but everybody that he knows that wasn't around there was not around that person. So he's quarantining because there's a risk of him becoming sick. He is not actively sick right now. If he was, all of you that were around him would be the close contacts that need to quarantine. So that being said, it's important that people who are quarantining actually do it. So within their home spaces, that's where we've seen a lot of spread, is they don't actually quarantine. So then they make the rest of the people in the household sick. And I
just thought I would tell my story today just because it's an example, like how we're doing it, and that trying to limit my exposure, everybody else's exposure in the household, so that I am now not that person having to quarantine because my son is, because he developed it. All right, so let's say, to be clear, now we're gonna go back to this restaurant guidance, multiple people in a household. To be clear, I have two people that wanna go have a beer and come in and they sit at a table together and they're not in the same household. Can that happen?
It shouldn't happen. I mean, so the guidance says no as of tomorrow.
And the order specifically versus guidance. So
Right.
it's,
Sorry. Yeah. Sorry. Yeah.
it is not allowed.
Okay, I'm going to, I just went and played golf with somebody. We're after golf, we're gonna go have a beer together. We're not sitting at a table, we're standing at the bar. Can that happen?
No.
You need to be outdoors.
Outdoors, so if I was outside and we're sitting at a table or outside and there's two of us, let's say there's four of us, are we allowed to be golfing together anyways?
No, not really.
Not riding in the same cart unless
Yeah.
you're in the same household.
But then coming in and we sit
Walking,
down,
you could.
4 people at a table from 4 different households. I mean, this is where you want to maintain I think someone said your quarantine, your one other household.
Mm-hmm.
Okay.
Yeah, and again, this is the type of stuff that's happening that's spreading disease. So it's people not doing these things. So we know that this potentially could still happen. And as a business, it's up to you to just do your best to try to identify what doesn't clearly look like a household or what looks like definitely more than 2 households, and just ask the questions. If they lie to you, they lie to you. But it's again back to your livelihood. If this is unsuccessful, our numbers are already saying we're looking at stay at home. So we got to try to turn that around.
If the restaurant asks and people say we're from the same household, is it up to the restaurant to then go into, are you being honest? Right. But if they've done the point of the asking, is it up to the restaurant to push any farther at that point?
We're not going to hold them responsible for violation of the order for that. That being said, if you're pretty confident, it's your decision on whether you want to refuse service or not.
Okay. All right. So we've talked golf, we've talked tennis. Let's talk swimming. We know that no swim team, but you can have swim training. How many kids per lane?
You could have swim classes.
Class.
Sorry. Yes.
Sorry, I'm reading the question, but you can have swim class. How many kids per lane?
Under yellow, as of right now, you can still have 2 people per lane as long as they start from opposite ends of the pool. But I would really encourage everyone to go to 1 person per lane. Just increasing that margin of safety.
Okay. Would private club facilities be able to operate since they're limited, like condo gyms and pools in a red?
No.
This came up in the spring as well. We had a lot of questions about that, and that's not the case. All right. So there's a question about college kids about after Thanksgiving and CU. And right now, as of Monday, CU is going virtual and they're not coming back after Thanksgiving, correct?
I don't actually know that.
I think that you mean, when is the semester over? I think
They're still, CU students, the semester's not over after Thanksgiving. They're just going virtual from next week on,
yes.
correct?
And as far as our CU age demographic, the only high risk group, the answer is no. We've seen illness across all age groups. We've seen increases across all age groups, positivity high across all age groups. So this is community-wide spread at this point. It's not a CU outbreak. It's a community-wide outbreak.
Are there any fear of college students from other communities coming back for the holidays and potentially the influx of virus into the community as they come back? I think this is any community, as you have, the kids coming back from college over the holidays.
I think the holidays are a risk, period, and not just, again, not specific to CU or that college age demographic. I think this is the great time where people want to get together with large groups indoors, and that is the recipe for how we continue to spread disease. So certainly if people are coming from states that have even worse conditions than Colorado, there's some additional risk there. People traveling at the holidays, there's a risk there. So there's lots of concern about this spike continuing to go up over the next 2 months. And again, the projections are the ICU beds within the metro area are going to be at capacity by December. So we really need to see this turn around. Otherwise, we are going to be at the place where our medical system is compromised.
Okay. So some more clarification questions on, you said meeting space, but if they have conference rooms with doors, in large conference rooms, can both rooms be in use at the same time? If people are using the conference rooms in an office space, and they have separate doors?
Yes, I mean, I think.
Oh, actually, I think this is a hotel, actually.
Okay.
So I think the question maybe about should you have groups gathering in a conference room that's a really poor idea. So, I mean, you need to make sure that they're masked and can maintain 6 feet of social distancing in the conference room. So it's just a poor idea to hold meetings in that fashion. They really should be doing virtual meetings.
Well, and under this event guidance, so if it's like, it says you can't have more than limited to 1 indoor event per venue, even if they're in separate rooms.
Oh, I see. So if you have a conference facility, that is you get 1 event, 1 conference room.
You can't divide it up more than the 25 people that you're allowed max. So
you have the 25 people. Okay.
So you could put 5 people in each of the large rooms, and as long as you're staying, below the 25 total.
5 people, if they're split up between those rooms, but you're staying within, you have 25 people max. And then if you're in one room and your room can't hold 25 people,
it's whatever the room can hold. Yeah.
It's 25% capacity or 25 people, whichever's lower.
Correct.
Since many restaurants are allowed to have outdoor dining in some of the public walkways, are pedestrians at risk? That's the question.
Everyone's at risk when you're around someone who's sick. So hopefully the people that are out aren't sick. Our high risk exposures are people who are within 6 feet of each other for 15 minutes or more. So if you're walking past a table and it takes you 10 seconds to walk past the table, that's not a high risk exposure. So, and you should be wearing a mask when you're out and about, walking down sidewalks.
Remember that. Yeah, exactly. Remember that in Boulder County, if you cannot ensure that you're going to maintain 6 feet of social distancing at all times when you're outdoors, you need to be wearing a mask.
So this is definitely a compromise of trying to get viability for businesses, and then ideally municipalities trying to address having adequate space, but they really should be trying to provide 6 feet of social distancing, for people that are pedestrians. But that is not a high risk exposure of walking past a table.
Okay. Unless that person stops and talks over you for 15 minutes, like where that walk, it's just like in a store when you're just walking by somebody. Okay, so let's talk a little bit about red. First off, can you go to the chart that compares and go to the real estate and field services? And I've gotten this question quite a bit, actually. So you talk about in here, Jesse, you specifically call out open houses showings, and those under critical businesses, the real estate transactions are called out, but there's a question about showings.
Not allowed under stay-at-home. Any field services are not allowed.
Virtual, you can do virtual.
You can do virtual.
Yeah, in the spring there were a lot of there were a lot of virtual showings. What's still allowed in that real estate piece is the actual transactional piece of being able to do your closing if you had, so it's not delaying people's ability to sell their house, or the actual finalization of that, but showings are not. So speaking of level red, again, we're not currently at stay at home. We're in level orange, and tomorrow we have, stricter version of level orange right here in Boulder County. We have a lot of questions on what would trigger us to move to level red. How much warning would we get before we move to level red? And
So,
why are we talking about level red?
so we are talking about level red because our case counts, our cases per 100,000 over a 2-week period are in the red. We are at the beginning of the week. So the limit for level red is 350 cases per 100,000. At the beginning of the week, we're at 438 cases per 100,000. On Wednesday, we were at 508 cases per 100,000. And right now we're at 600 something per 100,000. So we are in the red.
Going in the wrong direction.
Yes. When we moved from stay-at-home level 2, what used to be yellow, or what is now yellow, what used to be stay-at-home level 2 to level 3, that was the governor's decision without any consultation with us. That was an immediate move that we didn't have any role in. And that was based on our direction. Under the order, we are supposed to have 2 weeks to see if we can get our numbers in order. But the governor or the governor's office says you have 2 weeks. We come up with a mitigation plan. It gets approved. We have 2 weeks to get back into good numbers. But obviously, the governor can move us as it appears is best for the state, and he did that last week, and he could do that again. So I think the reason that we're talking about this, I think I've answered all the questions. The reason we're talking about this is we don't know when we're going to move to level red, but we do know that our numbers are there, and so there's a chance that we will move to level red.
Across the metro area, if you look at the other counties too, Adams County is over 1,000. Denver's in the 900s, or it might be over 1,000 at this point. The whole metro area is trending in the wrong direction. Our hospitalizations are trending in the wrong direction. I know we didn't go over the data piece today, but data across the metro area is trending. And across some parts of the state, you look at Mesa County on the western slope, they're also close to 1,000 per 100,000. So, that's why we have the charts up today. I think, seeing it where we are now and just preparing industries, because there have been some changes that were made between what stay-at-home looked like in the spring and what stay-at-home would look like if we moved to that. For example, in the spring, non-critical retail didn't have a curbside option, but this version does have a curbside option, which it's just giving preparation, just like we prepared for level orange when we were in level yellow, which I like the 1, 2, 3 because sometimes I can count better.
It's so much easier to say. Yes.
All right. So somebody asked if we can get a copy of these slides. I do send out a copy of the video. The slides sometimes we don't send out the slides sometimes because we have to get the legal approval to send out the slides. But I do send out a copy of the video to everybody afterwards.
And I saw that question. If you have questions about the practices, the level, go to covid19.colorado.gov, and you can look at your sector's practices, what you do regardless of capacity, what you need to do regardless of capacity. And then in terms of capacity, there's actually a chart that explains what each dial level means for capacity for different sectors. And if you really want to read the base language, the order is also available online. And I think, Corinne, you often...
I put the link in and I send it out with every email I send out is the order, because sometimes just getting down to the order itself is sometimes good. So is there a contact tracing form to use as an employer when to figure out if someone came into close contact, and how far back do you need to look
So
when trying to determine close contact?
there are a couple tools there. One, depending on how your guidance is set up, you may need to have been keeping track of who's coming in and out of your business with a login. As employees come in and out, they should be doing symptom checks, and you should have records of when they've come in and when they've left. In terms of applications for that or forms, Corinne, I know that on Wednesday, somebody kept sending you ways to track all this stuff. I think so. Those tools are available online. There isn't a particular product. In terms of contact tracing in general, I will point you back to that the exposure notification system phone app. It's not perfect. It's a great tool. It can help you. And then in terms of days back, I believe it's 2 days back. Lane, is that correct? Or Corinne? Yeah.
It's 2 days from positive test, correctly?
Right. Yeah, I was going to say, I posted a link in the chat around the outbreak guidance. So that really addresses individual illnesses as well as potential outbreaks. So that's going to walk you through a whole host of resources, information for you, so that if something happens, you can really jump to that proactively and start dealing with things.
And if you do have an outbreak, there is a form that you have to fill out specific to the outbreak, and that is the reporting form, which is also on that site, but I'm also going to put I have the link to that I'll put into.
Thanks, Corinne.
You're welcome. And that was another question that just came in. So I'm going to put that form in. There you go. I will get rid of that question, but there's a form that you fill out, and it's a state form, but it goes to the state and Boulder County Public Health. If you have 2 or more cases within 14 days, that is when it's an outbreak, and you have to fill out the form that I just put into the chat. All right, Santa Claus is coming up again. We have 2 questions about Santa Claus. Can a town hold a holiday event where Santa goes through town on a horse-drawn carriage?
So event, well, under the current order, that would be an outdoor event. So if you can maintain all of the requirements of the outdoor event, then that is possible. But that means somehow ensuring that only 25 people are there. So, or let me make sure that's true.
We have sort of parade guidance, outdoor event guidance, vehicle, event guidance. So, so that's on our website that would apply to something like that.
I would reach out to your, unless this is the municipality asking the question, I would reach out to your municipality to see what their comfort level is for an outdoor event of that style.
I swear I had another, I swear I had another Santa Claus question. I don't know where it went. Well, if I see it, I'll do that. And then also there is a particular person within Boulder County Public Health that works specifically on events. So if there needs to be, because I don't believe this person's actually with the municipality. So might have to work with you on the event piece to that.
Mm-hmm.
All right, if it's
that COVID biz email, we can work through that.
Yep, covidbiz@bouldercounty.org. And if you send those, that will be redirected to the person who has to do with events. Okay, is an outbreak if 2 employees test positive who work in different departments and never work around each other and exposure occurred outside of work?
So the exposure location doesn't really matter, but yeah, the Lane is shaking his head, and yeah, exactly. Those are not outbreaks.
They would need to have interaction at work where they were around each other for 15 minutes within 6 feet.
And does it have to be 15 minutes straight exposure, or is it 15 minutes combined exposure over a course of 24 hours?
Yeah, that's exactly
so
right.
This particular is a restaurant, and they're saying, over a course of a long dinner, a server could have 15 minutes of exposure with people at a dinner, correct?
Absolutely, yeah.
If they don't maintain 6 feet, so.
And that's why, early on in all of this, there was the recommendation that servers, limit the number of times you come back to the table, maintain 6 feet when you're when you come in, ask, how's your meal today? Don't stand around and talk. Try to do some contactless payment, those types of things. Those were the early on recommendations that we may need to remind ourselves about as we see this outbreak increase. And remind your employees about, that don't let down those standards, don't let down those reminders within your organizations. Are there legal consequences for the businesses if a client refuses to wear a mask?
If a client refuses to wear a mask, you have the right to deny them service, as long as you would deny anyone else who does the same thing service. There is specific civil rights guidance about this on the state's website. I really recommend you check it out. But if you have a client who refuses to wear a mask, you do not have to let them in to your business.
And there can be consequences if your business is sort of a chronic violator of allowing patrons without masks. It can be something that will impact the business.
Right. So yeah, thank you, Lane. That's exactly right. Like, we will almost certainly receive complaints about it, and it can go from us issuing you a notice of violation to us forwarding it to the state for legal remedies, or to the county attorneys for legal remedies.
And you can potentially lose your business license through the state or through the municipality.
There's a lot of customer confidence issues too. Like if a lot of customers don't want to go into locations where they're seeing a lot of with people without masks too. So there's a perception, there's legalities, but there's also perception issues as we see on both sides. Okay, so, all right. So as a financial institution, an essential or critical business, we're held to the 25% capacity, even if there's square footage that we could have for additional people. Should we do it based on that or fire code?
You do it based on, if you are a financial institution, you're most likely an office-based business, and so you would do it based on the number of people who are number of employees who are normally in the building. 25% of that.
Okay. Question about learning pods, home learning pods. There's a lot of families creating home learning pods right now, especially with
Lane's gone.
Lane's gone, but there are a lot of families creating home learning pods. If 3 students are all wearing masks and maintaining 6-foot distance inside, is it still safe to host those learning pods, or is that?
So learning pods are an interesting thing. They are not regulated specifically under the guidance. I'm happy to check with our attorneys, but my understanding is that those are group gatherings. So if you have more than 2 families, then you are violating the public health order.
I think there's some, I think there's some, we need to get some information out about that if that's the case, because
yes, I know there are a lot of people who are violating it, but I think that the reality is that learning pods are an unusual thing, and it's hard to regulate them. I would say personally, follow the order, avoid mixing with more than one other family. It's just for safety, for your personal safety, for your child's safety. Please try to do that. But I will follow up on that, and I will get back.
So to move on to the next, can you go back to the slide that shows the 3, you didn't go over it today, but the 3 different metrics that are used to decide the level on the dial?
Yep.
Because we have some new people today. And the question is, what are the metrics used to decide, where if we go up and down the dial?
So yeah, these are the 3 metrics: new cases per 100,000 over a 2-week period, percent positivity also over a 2-week period, and then whether our hospitalizations are stable or declining. And as I mentioned, I'll just quickly go through these. So
and when you get to the PCR one, let me ask you a question.
All right, excellent. So we are at 609.8 cases per 100,000, but you can see that we are much like the rest of the metro area and really much like the rest of the state. If you've been a regular attendee of our sessions, you know that a couple weeks ago, this map was mostly yellow, blue, and green. And now there are 6 green counties, and then everyone else is pretty much headed in the wrong direction. So percent positivity, yes.
Do they differentiate between COVID-19 and flu on the PCR?
Yeah, I saw that question. Absolutely. The PCR test does not collect for flu. It is just COVID-19. Yeah.
11 years old and under, for children, do we enforce masks? Should we enforce masks?
So no, it depends. The state and the county, our cutoff is 11 years old. For the city of Louisville, I believe, the cutoff is 3. So yes, within the city of Louisville, you need to follow that 3-year-old guidance. 3-year-old guidance. And again, if you know, the more people who wear them, even under the age of 11, the better for everyone.
Okay. I'm going to, we have a very specific situation here where it's a cultural institution, has 3 separate floors. They have, you know, office and all of that. So
I'm trying to imagine this specific cultural institution that is.
It's Museum of Boulder. We love you, Museum of Boulder.
Okay.
So they have 3 separate stories on top of, can they just have 25 people inside? Are we looking at their office space? And then we're looking at their other space separately. So they need to look at their office space, 25% of their office space. And then they have their cultural part. And that's a little different. That operates a little differently. And then they might have their retail space, but they just need to look at their spaces based on the different parts and then the no intermixing of those spaces.
Absolutely.
Okay. All right. So, all right. Where do we learn about real numbers and when we will go to stay at home? But I think the COVID19.colorado.com, if you want to track this map, every day it's updated on covid19.colorado.org. .gov. Sorry, covid19.colorado.gov. I just put COVID in my computer and it comes up. And you can track this every day. You can see and track. It'll track this, the PCR positivity rate, the number of cases per 100,000, as well as the hospitalization trends up and down. And that is probably most updated. Boulder County also has a data site that I send a link out to every week that's updated about once a week, that shows some additional data points by municipality, age grouping, all of that. But that's updated not daily, but weekly due to capacity reasons. But I'll give you some more information. It does show trends since March, and it's probably pretty valuable. All right. For distribution of grab-and-go meals to the homeless and transient population, what's the current maximum number of participants? Do we need to get contact information from those who receive a meal?
So homeless shelters and homeless services are essential. But I would say if you can operate outdoors and make sure that people are just, 6 feet apart as they come in to the space where you're handing out the meals, then there isn't really a capacity issue. When you're indoors, you're talking about the 25 people, 25% capacity for an indoor space. And then I think the question about there was another
contact
question.
Information for
I don't think so. I again, and I am not a public health professional. I probably shouldn't be opining on this, but I would say in terms of vital services, whatever is easiest for getting those meals out to people. I'm sure that there are some people in the homeless community who don't want to share their names, and if that's what stands between them and getting a meal, I'd prefer that they get a meal, and I think the community would as well.
Okay. So I think we have a confusion about beauty salons. It says on the COVID-19 business site, it says as long as we keep distancing, we can still operate. Under orange, a beauty salon can still operate. The facility just has to be at 25%.
Yep.
And you have to follow, again, all of the other criteria. It's not just capacity, it's the masking, it's the cleaning, it's the social distancing, those types of things that are under the covid19.colorado.gov site under personal services. Also DORA, the Department of Regulatory Agencies, has pretty good guidance for salons. It directly ties to the state in a lot of ways, but it has good guidance for that. So if you have any questions, we can, reach out to me and I can send you the links if you're not able to find it. So someone said, I heard a rule of thumb that if you're doing your symptom screening and someone says, I have a headache today, or, I have, a scratchy throat, that there's that whole one major or two minor symptoms type thing. I've sent this out a couple times, but can you explain that a little bit? And I'll put it into the chat too.
So I actually have trouble finding this, so I'm glad you're sending it out. But there are certain symptoms that have been recognized as sort of very indicative, and then others that are secondary, some like a headache. That could be so many different things. Yeah, the rule of thumb is one of the major symptoms, two of the minor symptoms. However, that's just a rule of thumb. If you, as a business owner, feel that someone is likely, for whatever reason, you think they have a headache, but they brought it up sort of out of the blue, and why did they bring it up? And maybe they don't want to get tested or whatever. You are required by the state to exclude employees who are positive. And so that means that if you suspect someone of being positive, you should ask them to not come into work. They should get tested, they should quarantine, that sort of thing.
I just put into the chat just general, and we know that fever, cough, shortness of breath, difficulty, the loss of taste and smell, those are those major symptoms that, that definitely no. And then the two of the sore throat, fatigue, headache, those types of things. And then I also put the symptom screening form from the state. Again, if you have your own version of this and it's capturing all of these, you can use your own version. This is just an easy one for you to use if you need to. Okay, we're almost there. We have 3 more. Again, if you have any questions, please put them in the Q&A. We're going to wrap up these last couple questions, and then Jesse was supposed to be camping today, so I appreciate you staying and doing the webinar. I get you on Veterans Day and camping this week. I
just love it.
You stayed for us. Thank you. All right, we have a data center that does a lot of things. They qualify as you see the question. Okay.
Yeah. So a couple things. So the question is basically, if I'm a critical business, where do I figure out what my guidance is? So first of all, take as your initial cut that you should, unless it's impossible for you to operate otherwise, minimize down to 25% staffing in your business space, in your office space, if it's an office space. If you can't do 25% because you need to meet some other requirement, remember that the second step there is the county's guidance, which says, please have people work from home. If there's a way for people to work from home and still do some of the servicing that you can do from your data center, then please have them do that. Third, you need to be doing all of the symptom screening, all of the cleaning, no meetings, all those sorts of things that are going to reduce the amount of person-to-person contact. But I think that the ideal here, if possible, is to reduce to sort of just the staff you need to operate the building 24 hours a day. Anyone else who does sort of the business side, if they can work from home, they should work from home.
Okay. This question is, do we have a regulation that to report positive cases to workman's comp insurance carrier? I'm going to actually put that question forward for our webinar next week. I'm going to have to download today's questions for that. I'm going to put that forward in that webinar for Employers Council next week as to whether or not, oh, do you have an answer?
I have an answer about learning pods.
Oh,
and
you have
I
an
was
answer about learning
wrong.
pods, not about workman's comp.
Oh, I don't have an answer about workman's comp.
Okay, so and I know who asked this question, so we'll try to get an answer on next week, the 19th at 1 o'clock. We're gonna try to answer some of these FFCRA requirements, some of the things that, you know, there was no handbook in place to get us through some of these pieces.
So I will forward there's an executive order that covers learning pods. I will forward it to you, Corinne. But the long and the short of it is, under the order, you should have no more than 5 unrelated children in a learning pod.
Okay. Wearing masks, social distancing.
Yep.
All right, last question, unless more come in. Can we do water swim lessons?
Yes. So swim lessons are permitted. Be sure that they're socially distanced. If they're improving your swimming, and it's people that don't need person-to-person contact, if they're not learning to swim, if they're just improving their swimming, instructor on the deck, and students 6 feet apart, so one in every lane. If it's a learn to swim, and this is not guidance, this is suggested by someone who runs a community rec center, and I thought it was a really good idea because it meets all of the requirements. If it's learn to swim, have a parent or a guardian and a child in the pool together, and then the instructor on the pool deck separated, wearing a mask, that sort of thing. And then everyone in the pool also needs to be 6 feet apart.
Okay. We had another question come in about whether someone's eligible for unemployment if they're quarantining. Again, that's the question we'll place for the Employers Council next week. Again, the 19th at 1 o'clock. If you can't make it, we're capturing these questions. We're going to send them beforehand, and we'll have a video recording of these answers that we're going to try to get covered, because we know a lot of these are coming up, and these are not things that Jesse has expertise in, or we're asking him to provide expertise in. I want to thank Downtown Business Partnership for working with me on trying to find a solution for this, for getting, some of these answers for businesses. All right, last call for questions. Otherwise, we're going to let you go on Friday. Again, these additional orders take effect at midnight tonight. So in essence, tomorrow. They are on top of the orange level. So if you're not mentioned or called out in the Boulder County, strengthening orders, you're still following the orange orders. Doesn't mean you have to close. It means that you're following the orange orders as they're directed. And then these additional strengthening are ways that we'll continue to try to mitigate this in our community. And we don't want to hit that red. We want to tell the story. We want to be as safe as possible. Someone just said, is it possible to go into stay at home within the next few days? It's just really hard to plan. And Jesse, you and I, we have calls. I mean, how many times do we talk a week saying, I push you? I'm like, businesses need more than a day's notice and and you know that. We just, we need planning time, and we understand that. This is not.
So I think that's, Corinne, you're absolutely right. We try, and we constantly remind the state that, we need 2 weeks notice. If we could have 72 hours notice, that would be great. And they give us 24 hours notice. So we are really intent on trying to get them to give us more notice. Again, if we follow the proper process, and we're informed that we might go to level red, and we have 2 weeks to come into that, we will let you know that we've been informed that we're going to level red, unless we can pull our noses out of it. But we're not there. We have not been told that. We don't know anything. We just know that our numbers look like we're in level red, as do the entire area. And so it behooves all of us to think about what happens at level red.
Which is why when you and I talked earlier this week, best preparation we could give was for you to show what does level red look like.
Yeah, no,
That's the best week. I mean, we just want to prepare just in case, so that it's not a surprise in any way that we can do it. And that's the best preparation we can do as a community, just knowing the direction we're headed. But we can all play a role. We can all say, I'm sorry, please don't do that. That impacts my business. Please don't have that party this weekend. Please don't get together with somebody else. Oh, your child's in quarantine. Can we make sure we stay for 14 days? We can all play a part because it's impacting all of us and it's impacting all of our businesses. And I hope that we can all continue. I
just read the next question as well. I should stop reading the questions. Boulder County Public Health is not pushing for anything. We're trying to figure out how to navigate this the same way you are. We're not pushing to move to stay at home. What we're trying to do is figure out how to stabilize our cases where, and reverse this trend.
And the question was, is the dial framework still in play? And it's still in play. It's still a county by county. And the idea is it's still monitoring, the local, we're still in the dial framework.
Yep.
Okay.
Absolutely.
All right. At this point, we're 101 minutes into the webinar. We've done a lot of webinars, but this is important. We want to continue to offer these opportunities to answer your questions. We get hundreds of questions a week via email, but this is that good opportunity. We'll provide a recording of this. I'll provide the resources in an email. Please keep asking your questions. Let's get the right information out there. Let's dispel some of the myths. Let's make sure we're getting this information out there for our businesses and for our customers and for our community. In the meantime, we'll see you next week. We have a webinar on Wednesday, and if anything changes, we know that we'll do something like this as a pop-up, but hopefully we're doing it on Wednesday. So
absolutely. Thank you, Corinne. Thank you, everyone.
Thanks. Bye.
Bye.